Hi guys, this is Dr. Ayele Okine and this is This Vet Wants You to Know. Today we're talking about aspirates versus biopsies. Do you know the difference? Yes? No? Well, if you shook your head no, you're going to at the end of this. The big difference is how the samples are collected and also what sample results from that collection. So basically, getting an aspirate involves using a small needle to insert into the area of interest using a syringe. Some cells are aspirated or kind of sucked out of the area of interest. And what you essentially get is like a fluid sample. And with that fluid comes any cells that are there. And those cells and that fluid is sprayed out onto a slide and essentially smeared. And you can stain that slide and actually take a look at it as is. The stain helps to accentuate and kind of highlight different areas of the cells that are there so that they're not so translucent, or it kind of takes out any blood, the redness of the blood, so that you can actually see what's behind it. A biopsy is actually where you're using an instrument to collect a piece of tissue. You can still do it either, with the naked eye, kind of holding the tissue of interest, or you can use ultrasound guided. You can do it with a camera. So there's so many different ways to collect a sample, but essentially you're actually getting a piece of tissue that you could touch and feel and manipulate with your hands. And that sample actually has to be processed. So it has to go into formalin in most cases, not always, it could be frozen. But essentially, it needs to be hardened in some way that preserves the cells as they are, and then also allows the lab to be able to get really thin slices so that it can be actually looked at through a microscope, because biopsy samples are going to be too thick to just look at right away. They have to be preserved. They have to be able to be hardened, so that way they can be really thinly sliced, so that they can be stained and then looked at by a pathologist. And so that process can take hours, it can take days, it can take longer than that, and then sometimes even less. The flash frozen samples can be looked at, almost right away. But again, really the difference between the two is an aspirate, you're just collecting cells and kind of looks like a drop of fluid, versus a biopsy is actually a piece of tissue and then the processing that happens. So basically that's the difference. So when you go into your vet and you say, hey, my pet has a bump, it's really important to know what kind of sampling you're going to get, and really the pros and cons. The nice thing about cytology, or getting that aspirate to look at the cells under the microscope, which is also called cytology, it's nice because it's often pretty quick. It's not invasive. A lot of times we can get a sample without having to do any sort of sedation or anesthesia, or if those things are needed, they're pretty mild. And we can often get an answer pretty quickly because the samples that are collected don't have to really be processed. The downside to that is not all tissues will exfoliate or shed their cells, so we don't always get a sample. Sometimes we get fat that's near it, or we'll just get red blood cells, and we don't actually get the what's actually making up the lesion that we're looking at. So that's kind of one downside. The other downside too is that there can be cells that look abnormal, and the only way to know if there's something like cancer or if they're normal cells that are being irritated or are reacting to something is to actually see how those cells are interacting with normal structures around it. How are they interacting with the cells nearby? And that's really where you need a biopsy to see, okay, are those cells engulfing other cells? Are those cells destroying other cells? Are they diving deeper into the tissue than they should be? So there's so much detail that can sometimes be needed for pathologists to say something is cancerous or not, that in many cases you need a biopsy, or in some cases you need a biopsy. Even biopsy is not the end all be all. Sometimes that's inconclusive, and there has to be post-processing sampling that has to happen, or post-processing analyzing that has to happen with special stains, or certain PCR, DNA tests. So there's all these other things that can need to be done in some cases to get more information. But again, sometimes starting with the aspirate, trying to see if you can get an answer and get started on your treatment is helpful. And then if not, go to biopsy. Or again, if it's not in a location where cytology is really going to be helpful, or it doesn't exfoliate well, then maybe a biopsy is something that you're going to need. So again, it really depends on the details of the lesion and where it is and what we think is going on and all of that. But again, there are differences between the two. So when you go to your vet, it's definitely nice to know exactly what you're talking about. Okay, well, that's it for today. Nice to see you guys again. Hopefully I'll be back soon. Thanks.